Yun ang feeling.
We've been lying down the whole day. Hello. She's like, I'm sleepy, leave me alone. Look at all these people visiting you. And you want to
Very
sleep.
drowsy.
Yeah, she's like, say hello to me, the people. Hello, everybody.
Bina. Bina. Hello. Bina.
Yesterday she was like, she's shouting at me, so I'm playing music. She's like, no, 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 no. I'm like, so you don't like this song? No, 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 no. Are you shouting at me? Yes, all these people came to see you. Let's sit nicely.
Hello. Laughing. Heavy. Bina. Hello. Hi.
She's like, I don't recognize, I recognize some of them, but who are you?
So drowsy now.
So who is who here? This is my sister. She will be the one to look after. Okay. Hi, what's your name?
Amy.
Amy. Nice to meet you.
Hi, I'm the cousin of her husband,
Cousin of my husband. And your name?
Mylene.
Mylene. So, Amy, you were looking after her mostly. Okay. So, from occupational therapist, I'm an occupational therapist. This is Mpo speech therapist. I'm Anyanet. So, I explained some things to Mom already. The exercises. I've printed out some things just to explain the exercises again to you. And then also on the splits, on wearing the splits. The splits are also for me, I'll make them. So just to make it a little simple, I said you can apply the elbow, you have an elbow split and you have a hand split. I don't know if you can see that. Have you seen?
No,
Not yet. Mind if I show you?
Yeah, sure.
So this is for the elbow. Because I'm sure you've seen that she's quite tight in this position and we want her to stretch and straighten out the arm. Okay? That's the one thing we want. And the second thing we want is we want the thumb to come out of her hand. If you've seen that, her thumb is always inside the palm of her hand. So this will help to do that. So these two you can apply together. So you put on the elbow when it's in this position on this side of the arm. You can see this inside of the arm. Put it like this. So after you've done the exercises, then you can put the splint on, okay? And not put it on like this or like this, but straight, okay? As straight as possible, okay? And you always start with the middle strap, and then the splints are marked with the arrow pointing down, and it says this one is an L for left, okay? So you will put it on the left side, arrow pointing down, which means it's going down like that, okay? Does that make sense? Okay. And then you put the middle strap and then the other two straps. This is for the elbow. Then for the hand, just you open here and then you put this on the finger. I'll just quickly show you because this is a little bit more tricky. So after you've done stretching exercises of the thumb, just put it on here like that. Pull it out of the palm of the hand, okay? And then you put the strap around the wrist. Okay? So we want it to come out of the palm. It shouldn't touch the palm of the hand. You see the difference. It's inside and it's a little bit more out. Okay? To get it more stretched out, we have this splint. But this thing limits other function of the hand because it's including all the fingers. So this you can put at night time. Okay? So this
Can be this one could be she can use it for overnight or
this one you put during the day. It's fine.
this one. This one should be like overnight or
Yeah, so when she wakes for her first wake up during the night, you can remove it. These for maximum 4 hours at one time, but 2 to 4 hours, okay? So this one is just to put the thumb should go there. But this one includes all the fingers. Put this one over here. This one over here. This one over all the fingers. And this one, you can ideally put it from the inside so you can pull the thumb out. Okay?
Yeah.
So it's like that. So completely out of the palm. Okay? So that you can wear. Yeah, it's good that you take it. So that's a nice stretch for her during the night. This one sometimes is, the nurses say sometimes it's uncomfortable for her. So it's okay if she doesn't wear it anymore. So she can rest. Okay? Yeah, that's all from the splint. Do you have any questions for the splint? If they do get small or there's any issues with them, you can call us. It's in the pamphlet. And you can come back and we can make new splints for them. Because usually when they grow or they gain weight, then it's too small. You'll see usually it should fit. Like this one is fitting. I'll just quickly show you. This is the left one. So this. Put the arm like that. Like that. As far as you can. It can't go all the way straight. And then you put this. This is the middle part. There. And this goes around the elbow. You move that one first, and then this one, and then this one. Oh, it doesn't matter these two, but this one first. And not
This one in
too
the middle should point
over the elbow, yeah, over, it's going down. Over this elbow joint, okay? So it doesn't bend, okay? So she's fine, she can tolerate it, but it's better during the day.
2 hours.
2 hours on and 2 hours break. You can do it about three times a day. Okay? But these two, like I said, can go on at the same time. And then when you remove them, you can do exercise with her and do other things with her. Okay? So it's just for the 2 hours on and then 2 hours rest for her to move her arm. Okay?
Look, I noticed that it's just because she has a stick here, because she's not lifting it like this. There's no issue in her shoulder.
It's not. It's also a little bit stiff in the shoulder, but it's more. This is
I think I was able to manipulate her quite a bit. I think it's part tone, part behavior.
But it can be
so
positional.
Positional as well. So some kids what
Habit.
is once they feel they try and stretch their hands and they can't, this is a normal position they stay in. So over time it feels like it's hard, but you saw what she did. She was able to lift it nicely. She's not complaining or moaning. She will resist a little bit, but it showed that it's more behavior. If you lifted and there was pain, and she started crying, or you felt that really you can't move, you can feel you can move it, but just with a little bit of resistance, she can lift it. So it shows that it's more behavior. So you need stretching.
So the same exercises I showed you with the shoulder, you can do with her. Okay? You know. You forget something. Do you want to do something else?
No, you can finish, and then I will.
So quickly show you. So I did put it in here as well. So this one will just show you some of the exercises. Okay? And this is for the arm. So up, over. Just read and it will explain to you what I will show you now on her. Important is the hand and the thumb out. Okay? And then this just gives you some positioning things that you can also do with her side lying. How you should remember how we spoke about putting her arm and tummy, which is also good for her head development, neck development, for her back and her tummy muscles. Also then encouraging her to put her arms out and start pushing on her arms, later when she will start doing it, start reaching for things as well. Okay, so that's just giving, and this is explaining about the splits. I also put another one in here about the splints and what you should look out for: skin irritation, pressure marks, any red areas. If there's constant red area for more than 20 minutes, then it's a cause for concern. If it's going away after 20 minutes, then it's okay. Okay, so this is something you
But
look
if
out
it's not going for 20 minutes,
for. You have to come back to us so we can have a look. Okay. But check if it's maybe she's swollen that day, or it can be multiple causes. Try it again one more time and then see. For the exercises, I'll just briefly go over. I'll show you just one of each. You can do it 10 times of each joint. So the shoulder, we just want to move up. Like that. Okay. Now remember, because she's not always going full range all the way, it might be a little bit uncomfortable for her. So just, you can support like it showed in the pamphlet. You just support with the one hand and you pull with the other. Okay? So not just doing with one hand like that, because that will cause injury to the shoulder. Okay? So you need to support her. Yeah, support her. You can feel if you support you wherever is comfortable for you to support it, as long as you don't just pull at the end of the arm. So usually we say you support proximally, so inside and not pulling from outside. Okay, so up is one movement, up this way is another movement. Okay, so it's up this way and up this way. Okay, and then
side or front.
Side, this is one movement, and then up in the front. And then inside. So you feel a little bit, there's a little bit of resistance now, but the basic movement is you want it to touch her shoulder.
Touch her
almost.
shoulder.
Okay? Pushing. But again, I'm holding here and I'm pushing with the one hand. Okay? You always use both your hands when you do the exercise. For her, very important is the elbow. So this one will support at the elbow, and then we will, like I said to you, Mom, what I do with her, I just put my hand or my fingers inside. So while I'm stretching the elbow, I'm also stretching the thumb or fingers out. Yeah. So all the way straight as far as you can, and you can actually hold it for 10 seconds. Keep the stretch, and then again.
For 10 times.
10 times. With her, you can actually keep it. It will be, this is a good stretch because the muscles are already shortened. Okay. So that's the elbow, and then the forearm is just this movement. You want, it's basically, okay. And then for the wrist, you have this movement, and you have this movement. Okay, so we want this one. And remember, don't go quickly. Take your time. This movement, and again, I'm holding with my other hand as well, and to the side. Okay, like waving. For the thumb, we have two movements that we want. It's from there out and from there out. Okay, this one and this one. Okay, and one. So she's like that, then one out, and you can actually also keep this movement for a long time. You feel it's quite tight, this movement. And then we want from here out. So there, in and out, there, in and out. Okay, and then all the fingers you want bending and straight. Bend, straight. So you can close them like that, bend and straighten. Can you see?
Yeah.
And you can bend them, bending all the joints and straight. Because you want to make her to be able to make a fist at the end. breakfast and you wanted to complete all the fingers. Okay, but you can do them one by one. Especially this little finger, she doesn't have any movement or a lot of movement in this little joint. So you would like to actually focus on stretching, bending the joint all the way out, and actually straightening the joint also. The same when you put the splint on, I should have shown now. When you put the strap, just make sure all the fingers are straight. Okay, not inside the strap. Okay. And then the leg, we can go through the leg also just quickly. But she's very active in her legs, like you can see. So you can just gently bend and straighten the legs. Okay, especially the feet. Just make sure you bend like that, not that. This is not actually in my brochure, so because she's quite active in her legs. But you might as well, when you do massage, you can just quickly do the legs as well. Okay, bend and straighten, and to the side. So you have this movement, same as the wrist. Okay, that's it. And then our trunk is not really tight, but you can also do the trunk. Just bend. Your baby's like this position. You can just gently move her trunk just to get her hips body a little bit loose. Okay. Yeah, that's about it. Do you have any questions?
So for the tummy, it's only the we need to place like a pillow.
Yeah, I was gonna say, can you show them how to put in
From the
prone?
tummy massages. So I showed mom you can use any roll up. You don't have to necessarily use a roll or anything for support, but it's always nice, just especially initially, if they have something to support them, because then it's a little bit easier for them. So maybe I can just use. Otherwise, we'll just use a flat surface. Oh. So we just have some roll there. You can use anything. Sheet. Okay. And you can just put this roll. Sorry, baby. Under her chest. Okay. So we want this. I'm gonna lift them over her chest.
And she will not like it because she's not used to it. But the more she trains,
Bring in her legs and I can keep her like this. And she's going to fight you.
yeah, she won't like it at all.
How long left?
See how long she tolerates. Don't let her cry too much. But start with, like I said, 5 minutes, 3 minutes to 5 minutes, and then 10 minutes, 15 minutes, 20 minutes, 30 minutes. Okay?
This exercise will help her gas.
It will also help with the gas.
Because she's she's fighting with her gas. She's pushing her.
So the big thing about putting children in on their stomach, number one, is for the strength of their muscles. So it works their stomachs, it works their arms, it works their neck. So because they're holding down like this, they want to push up. So you're working these neck muscles. Already because her muscle, remember we talked about it, her muscle tone is so low and her muscles are still weak. This is a good exercise for her because it works for the neck muscles. Not only does it help with controlling her head when she's eventually sitting, but for feeding as well. it helps the muscles of the neck when she swallows to swallow nice and effectively. It also helps with clearing gassy babies like actually being on their stomach, because what it does, it puts pressure on the stomach and it helps them clear quickly. So it's uncomfortable for her now because it's not a position she's used to. But the more she gets used to it, she actually even they can even sleep in this position, which is what's recommended. We recommend that they sleep in this position only when you are sitting next to her, or one of you's there. Never put her in this position and you go out, because sometimes she might be on her face and not turn us. Okay. Yeah, but this position is a very good one for a lot of the skills that she needs.
Just got her because she had her PDA surgery. Because I'm just worried that it might affect her.
But it was a long time. It's been more than 2 weeks, right?
Yeah.
It's been a while.
So it's fine.
Once the scars have healed and the stitches are out, usually they say you mustn't put her on your stomach for how many days after the surgery? I think 2 weeks. Yeah. After that, it's only for the scars, and what else is it? It's for the scars and what else? Why they don't allow you to put her the pressure. The pressure. But after that, she should be fine, and she's at the age now where she should. And that's why you see me when I'm working with her, I put her in supported sitting a lot. She shouldn't. She's not really. She's a baby, but she's not really a baby anymore. So we need to try and get her upright more, so that she can start using her neck muscles to keep her own head up. So that's why we try and sit her up and supporting. If you sit her up like you saw, like I do, I hold her by the shoulders and I let her head. So I do still have a bit of support so it doesn't fall back. But she'll show you now. But you want to start encouraging that movement as well, because you're encouraging strength in the stomach, in the shoulders, and the neck.
So you can support the neck, but you can also let go a little bit. To let her move around.
I tried once to place it like her in sitting position, but I noticed like there are times that she looked like drowsy. It's because of her legs is not that strong. How long should I keep like this?
Well, you should definitely monitor and see how she is.
How long she can
Usually
tolerate.
sitting up actually helps the lungs. It helps breathing compared to being flat. I don't know. How long?
Yeah, the thing is,
Difficult to say.
I would say do it for short bursts of time, especially because she hasn't been doing activities that a baby should be doing, like feeding. So we need to get her back into getting energy for that. Children with PDA have poor endurance because their heart works over time, so that's why they get tired so quickly. But like I said to you 2 days ago, it's like working out, it's like exercising. Children with PDA need to build up their endurance because their endurance was already so weak. So with her, the only way we can prevent her from sleeping so much and falling asleep when she's drinking is building her endurance, and that is things like sitting up. So you can have an activity in the day, and you don't have to take out time in your day to make these activities. After you change her nappy, if you've got an extra 2 minutes, just sit her up, hold her for that just 2 minutes. Small exercises in between. Exactly. Every time you change her nappy, do an exercise. If she's awake, do an exercise. When she's awake, just before her NGT feed, do the stimulate. So always do a feeding stimulation before feeding, so that it's part of your routine. Do change nappy and then do your stretches. So every time you change the nappy, you do the stretches, because then you incorporate. It's not like you take extra time, because you guys are busy. You've got work. It's so many things. So already what you're doing, incorporate it into small exercises, because then you get a lot of small exercises with a big exercise at the end of the day. Am I talking too much?
The same with like stretching in the bath. You can do some movements. When you put her out to do the massage or put some cream on, you can do some movements. Like she said, you don't have to specifically sit up. It won't be too hard on you as well. if you have to do that. And then another, I just want to show you that if you just for picking her up and also for prone, you can keep her like this in this position. When you are lying on your back and she's like this, and you are speaking to her, she will lift up her head. This was also part of exercise and also strengthening the back and the neck muscles. This is actually easier than putting her down because now she feels, okay, mommy or auntie is with me, someone's holding me, so maybe it's not exercise.
Exactly.
Okay.
Yeah.
And already she's quiet and she doesn't mind it too much, but she's also moving and she's lifting her head and
She's
exercising. Okay.
A lot of the parents, what they do, or family members, what they do is they find a piece of fabric at the shop that's long, and then they wrap them around their chest. So she sits. So basically, we gave you a pamphlet called Kangaroo Mother Care,
Kangaroo.
where it shows you how to wrap them. So you get a long piece of cloth, and basically you position them on your chest. And you tie them up in a way that they're so secure. And while they're on your chest, you can do things in the house. So it shows you how to tie it in a way that they're secure. I mean, he is slightly bigger now, but she's still light enough for you to be able to do such an exercise. So that's also one where you want to spend time with them, but you also have things to do in the house. Just wrap them on your chest, and then you do all the other things in the house as well. So that's a nice way. Like I said, from the first day I saw her in the hospital to now, she's much more active. She's more interactive. You can even see she's aware of people. She's making a lot of sound. So we want to keep stimulating that. But a big thing with her, we want to promote her using these hands because this is the position we get. We want her to bring those hands to the middle a lot. She's starting, but she's not keeping it consistent, which will also eventually help with the suckling.
I said to mom, we can maybe even swaddle her. I know it's not ideal to do swaddling like this, but just
But we can alternate, swaddling like this and then swaddling like this as well.
because usually swaddling is
We do
hands in the
we
middle.
swaddle them with their hands
Hands
like
in the
this.
middle, but for her case, like she said, you can alternate.
So
we
one
swaddle
time
her.
like this, and then when you change her straight, so you basically change the arms like this so they can stretch at the same
Stretch, but then
time,
also
and then also bring
the
the hands
position she
forward.
wants.
Okay. You ladies are just talking too much, and I want to sleep. I know.
So then, Paul also added some prices for you in her.
Yes, we can go. I just want to go through the stimulation, and then I'll just show you the prices for if you'd like to come for therapy. Then I would can just check about.
Because
Just check out.
that was one question you also had to me before. So because she definitely does need therapy. And at least so we can also show you more techniques and see how she is developing. Because with every developmental milestone or developmental age, there's some milestones that she would need to reach, and that is achieved, and that's what we will be working towards. Yeah. We don't want it to be delayed. We don't want you to come back in a while and we missed it out. We might start. It's better to start earlier.
Yeah, and I think part of therapy is also to just to sort of compare our home program to say, okay, this is what she's doing, this is what she's not doing. I've been trying this for a long time. She's doing it well now, but this I'm struggling with. So we can give you also different strategies, like she said, so we can check her progress. Is she progressing slowly? Is she progressing fast? Should we give you should we focus on new skills, things like that. So just to also help guide you, because a home program will help you, but only to an extent. It's always better for someone else to just have a look and say, okay, okay, she since the last time we saw her, she's looking better, or no, she still hasn't progressed, or she's actually progressing really quickly. We can move on to the next thing, also to see whether her feeding improves to an extent where we can start weaning her off the tube, so we can get the tube out. So things like that. We will need to be working on that a lot. Yes, that's basically. So from feeding side, the biggest thing for us right now is, like I said, keeping her upright. Why? Because the study that we did where we took her to X-ray showed that she's drinking milk, but it's sort of sitting. It's taking a long time to go down into the stomach. So in cases like this, if you're giving her milk through the gravity feeds and she's lying down like this, milk will go down, but it will sit here. And then what happens when she breathes, either it will go back up, or it will take two, sorry, I said, or it will just build up in one place and then she'll start coughing and choking. So we don't want her, and once she coughs and chokes, it means the milk went into her lungs. And we don't want an infection because that affects oxygen and all of that. So a big thing with her is trying to always keep her, I think she's like, always keep her in.
Should we
Yeah.
find this address? Yeah.
That's how the bed was. We just
Yes.
put it down.
The bed. You just that red thing. So this is a nice way to also put. So you can support, like I said, she's still a child, but she's at the age now where we can do a lot with her. She also is very active, so she wants to look around. So she's looking at the ceiling all the time and not me. So it's better if she looks in this way so she can have that view around her. Can put toys around her as well, which she enjoys. And so that's the one thing. Always trying to keep her upright. I would say, especially after feeding her. Whether it's if you tried with the bottle or as long as you feed her, whether it's with a tube or with a bottle or both, you always 20 minutes after she sleeps up as upright as much as possible, even if it means you want to hold her as well.
From feeding the 20 minutes.
Upright, yeah. So she
sit her
can sit like
straight.
this, exactly.
Upright, yeah.
Yeah, upright.
And
Usually
if you're holding her upright or putting her in bed upright,
upright, yeah.
as long as you're
Exactly.
not doing movements or putting her
Her
down
on the floor. So we don't want her lying flat because the milk will come back. Okay, so she's usually, we've tried this a lot, she's usually comfortable even sleeping like this. She sleeps in this position quite a lot here. So that's still fine. So if you see she's sleepy and you don't really want to carry her, you can just put her in this position, swaddle her because she's got the tube in case she wakes up, and then let her sleep in this position. It's absolutely fine. All right. A big thing is, another thing is, we want to work on, so the suck is much stronger now. Before I could take this out easily. Now it is strong, but it's still very inconsistent because of endurance. I mean, endurance is a big thing. So I'm gonna just show you quickly. So a big one to stimulate, I'm gonna stimulate her right now. So we always want to mimic movements of a suck, okay? So mimicking movements of a suck is working outside in. Everything is in the brochure. So you're gonna take your two fingers always, and you're gonna come inside. They hate this. And you're just gonna pull her cheeks outwards. So you can either do this from the outside. I would recommend you do it from the inside as well. So you're stimulating these muscles. So you just do it 3 times. 1, 2, 3. So what you do, you're working on that muscle. Then with your 2 fingers, 1, 2, 3, and here as well. I'm sorry.
Since we will place our finger inside, we should wear gloves.
Just
or
one, you can wash your hands. Just make sure you've got short nails. Okay. And then 1, 2, 3. If you've got gloves, it's also absolutely fine. And then you do it basically like you're brushing teeth. And you don't overstimulate. 3 times is fine. And then you go 1, 2, 3. 1, 2, 3. And you see what she's doing already? She's trying to suck on my finger. 1, 2, 3. I'm not playing. 1, sorry. 2, 3. Okay. And then the most difficult one, because some kids do become a little bit sensitive, is the tongue. Alright. And then what you do, you also put pressure, 1, on the tongue. So I'm going to make you feel, so I just rub the tongue like that. Okay? Why? Because it helps just create that groove as well. Also, it helps you feel her tongue. Then you keep your finger there. You want to let her suck. Okay? So you want to feel, is her suck strong or is it weak? Can you easily pull your finger out? or is it very difficult to pull? I know with her, her suck gradually gets stronger, meaning it's not strong. First, it starts off at weak, and then she starts actually latching. So what you want to do is let her suck on your finger so you know what an idea of her suck feels like. And then what you can do is, once you feel her suck is strong, meaning you try and pull your finger. I'll show you this now. See, I'm trying to pull my finger, I can't pull it out. She's actually latching. Then what I would recommend you do is you can either use this and this while she's sucking and you see, okay, she's maintaining saturation. She's still awake. Then you get a smaller syringe or a dropper. So usually these droppers that you find in once you get medication, and you put 1 ml inside. I would recommend you do it with your finger because it's easier to use. Yeah, so 1 ml. While she's sucking on your finger, you're gonna drop 1 ml of milk. Then you're gonna watch her saturations, right? If she's able to finish that 1 ml of milk without desaturating, then you move on to 3 ml. Okay? So but only if she's awake. We put all of that in the. So if you see she's awake, she's engaging with me. So I can continue. Then I do 3 ml. If she still maintains, obviously if she desaturates below 90, then you stop and then you just give her the pacifier to clear. But you're stimulating, you're exercising. If it goes well, then you move on to 5 ml. Okay? And then if that is fine, then I told you, so you will take her bottle with the ultra pre-meat. Don't worry, I wrote all of that for you. Ultra pre-meat, and then you put 5 ml in, and then you give her 5 ml to drink. So that's how you gradually increase. That will help you to see what amount is she able to handle without desaturating. Okay? If she desaturates, let's say you try 1 ml, she's fine, you try 3 ml, she's okay, but when you give her 5 ml, she desaturates, then her basic is 3 ml, meaning she is only able to handle, but from 5 ml it's too much, she desaturates. Then you do 3 ml for 1-2 days, you just give her 3 ml. Then after 2 days, you try again. 1 ml.
So once a day, we will try.
So
not every feed.
Not every feed, no. So if she's I mean every feed you can try. I say do it on demand, meaning you don't have to do it all the time. Do it when she's awake, when you see she wants to feed. I say on demand because you're still giving her through the tube, it's okay. You also don't want to overstimulate. So I say if you try 3 times a day, it's absolutely fine. If you try it once, it's absolutely fine as well. I would say the more the better. With every tube feed, I would recommend that. Stimulate, give drops, give tube feed. So I repeat. So try 1 ml. If she's still maintaining saturation, go up to 3 ml with a dropper. If she's still maintaining saturation while you're doing this, then try bottle. Bottle with the teeth that I gave you, I wrote it down, 5 ml. If she's desaturated on 5 ml, you continue with 3 ml for the next feed for the next 2 days. After 2 days, you try again, 1 ml, 3 ml, 5 until she's able to tolerate 5. Once she's able to tolerate 5 ml, then you don't have to do the dropper again. Then you just start with bottle after you stimulate. Okay? Then start with bottle. If she tolerates the 5 ml fine, then you do that for 2 days. So you always increase after 1 or 2 days, just to make sure she's consistent every time. And then you increase after every 2 days with 5 ml. So, but I will be seeing you in between. So I don't think I'll see you too far after that, so that we can go through all of it again. So with us, for me, it's before every feeding, oral stimulation like I showed you, stimulate, dew drops, and then bottle. If she desaturates or falls asleep anytime in between, before you start the bottle, don't start the bottle because she'll definitely desaturate. Okay. And always, if you did try the bottle, every time after you try the bottle, give her the pacifier afterwards, so she just clears all the residue in the throat. Okay, I know you're sleeping. All right, any question for me?
No, is it fine to place her over there, like this, for example, after food, and we place her like this position.
Definitely. At
Yes.
night time,
But
this is
we
actually good for
began to
gas.
fall asleep and she was lying like this now. It doesn't affect any.
It's absolutely fine, especially because at night she wouldn't really be this open. You would swaddle her. So you remember every time I was with you, I would rack her first. So you'd rather rack her and then put her with boundaries like this so that she doesn't roll. So it's absolutely fine. If anything, like you said, it's better. Another position.
They recommend it, especially for reflux babies.
Exactly, especially for
To always keep them when they're asleep. Keep them on
another
a wedge.
yeah, another
Do you have
position.
you don't obviously have a bed like this. Do you have a wedge or something
I mean,
or then just a pillow?
I don't know, towels as well.
Towels.
So what they do is they use towels in here and a big sheet, and they took a towel and they rolled it
But
in the
something to
sheet.
keep her upright.
Can we use pillow?
Pillows.
Pillow depends on how your pillow is. Sometimes
How
if the
soft
pillow-
it is?
If the pillow is too poofy, then she will roll off the pillow.
Ah,
So you have to see, yeah. If you can find a nice flat pillow, then you can rather put layers of flat, or you can rather roll it up with towels, maybe better. But you do get wedges as well. They sell it for babies specifically with reflux and feeding problems. It's basically like a foam, piece of foam, like just a piece of foam in a triangular shape that you put in the cup. That they can-
Another position is side lying. That's even perfect because it promotes her hands
Just to the
Right
middle.
side or left side is fine.
Exactly. So side lying. But remember, always it's just in an elevated, so
Exactly.
not a flat.
But so if she will have that she's having a vomiting, what we should do in that case?
Sideline is the best because then it will come out from the side.
Gravity
If she's
will
lying
just-
like this, she will breathe it in and she will choke. So sideline is usually the best position. Has she been vomiting with the gravity feeds?
no.
No, not. But yeah, but I mean, it does happen. It does. It might happen that she will vomit. You know.
Especially if you're giving the bottle.
Exactly, and when you increase her milk and everything, it's a possibility. So side lying would be the best. And if you see that she's vomiting more than once, like maybe after every feed, call the doctor or go to your nearest clinic and let her know. Because it might mean the food is too much for the stomach.
And then like we will try at the maximum 5 ml, then after that we have to see you. Or
Yes, I
Or
would
we can
recommend
increase.
the next time. So if you see things are really going well, the ideal is for you guys to come every week if possible, or if you come for your checkup, pop into our department and try and see you. But let's say by some means you really can't, you're busy, but things are going well, there's nothing wrong. Her chest is okay, she's maintaining her saturation, she's on 5 mil, like I said. Then every after 2 days, if she's coping, add 5 mil. So you'll add, let's say you gave her 5 mil today, she was good. And then later on you gave her 5 mil again and she was fine. And the next day as well, you gave her 5 mil for the next. So always do trial one more day and then you increase, because that shows you consistency. So you can't just because she drank 5 mil now and then you try it next time you're like, oh, I'm going to give her 10 more. You need to try at least 3, 4, 5 more times again to make sure she still maintains. And then after a day or so, increase by 5. So you'll see if she's gradually improving, she'll do 5 mil. Today's what? Today's Thursday. 5 mil today, Thursday. Saturday, 10 mil. Monday, 15 mil. Thursday, like that. That's how you grad after every second day. But stimulation is important with cases like this because it's not just about feeding. It's not just saying she will drink. No, her muscles, she wants to, but her muscles and her energy levels and her capacity, because she was so sick, don't allow her to. So you have to get her there. So for her age, she's still a little bit behind with a lot of things. So that's why we need to put her on her stomach, give her sitting with support so we can help her catch up all those skills that she should have been doing my mouth, and already she's growing, so she's going on to 5-6 months. She'll be starting baby food. We need to make sure we've got the first skill right first before we go on to the other skill. So some kids progress really slowly. Some kids progress at a good level where they half getting drinking and half getting to chew. Some progress really quickly, whereby in 3 months they completely drinking and they're eating fine. So we just go with her progress.
So for now, we will keep only milk. We will stick to the milk. We cannot give any different for her. When she can start eating,
And
And then
like
liquid.
water, or yeah.
I think with her by at least 5 months, then you can start introducing like baby foods and things like that. Remember,
Because she was gonna be 5 months when
Next.
she was born. She was gonna be 5 months on 14th next month.
But remember, she was born early.
Yeah,
In
like 2 months.
2 months. So she will then technically be behind 2 months.
Okay.
So usually we work on the corrected age.
and we always go. So baby foods also go with a baby's development as well. So you can only. The reason why babies drink milk, only milk, is because they're lying down, they're not really moving, so they need something to just go through their bodies. Baby foods need your digestive system, so at that age, usually, they're starting to sit upright, they're more active. That's why they need baby foods, because they need more energy to work. So we can't really be giving her baby because her stomach isn't ready. So her muscles aren't ready, her stomach isn't ready. She doesn't have the strength yet or the movement yet to be able to process that. So we will definitely work on it. So we're working on her, not necessarily with her case, her age, but her development. So her age might say 5 months, but her development might be only 2-3 months. So that's how we're working.
And another thing, because she's taking like 62 ml right now. When we should increase her milk every week, or
Through the total amount, the dietitian will. Unfortunately, that's the dietitian's job. So she will. Either the doctor will. So they will weigh her weight now when she goes home, and they will tell you how much.
We'll work it out.
and last
Oh no, no
we
worries.
were concerned, like because we are advised to aspirate
Yes.
before giving the milk. And there, when we check the colors, I don't know what we call that one.
pH.
Check
pH,
the
yeah, acid. Yes.
For example, twice we did already, but it's more than like 5. It falls to 6 or 7.
Yes.
Do we continue to give her milk, or what we should
So
do
they
in that
will.
case?
The doctor will also advise you because that's a medical issue. So he will advise you what happens with the acid. So if they and the nurses as well. So they'll chat to you about all of that. Unfortunately, it's not our scope. Yeah. So they also just want to check. I think the pH also tells you if the medication that she's taking is working, because they are giving her medication to reduce the stomach acid as well. And that's why the milk is sitting and coming back up. So they will advise you with all of that. But that just shows you if the medication she's taking is working for the acid. Okay. But positioning will help you a lot. You also see a bit of a difference with how you position him, because that contributes to less stomach acid as well.
I don't know if it's the is it necessary at in the middle of the night we have to give her every 3 hours?
So in terms of feeding, we say now. Remember we had discussed. They give her you give her every 3 hours because you are in the hospital and you're working through a system. And the hospital will give you the total amount of milk she's supposed to take a day, as long as she finishes that amount a day. So we call it on demand. So you can give it to her on demand. When she's awake and you can see that she's a little bit hungry, you can give. So with the tube, it's a little bit tricky. So you have to find a little bit of a system. So you don't just give constant, because that's when she'll vomit. So with the tube, you need to find a system that it doesn't have to be every 2 hours, but it needs to be a system of enough hours in between. between each other so you don't overfeed her or get her too full too quickly so that she vomits. So if you find that a system of every 2 hours works for you, then it's also still fine. Then what you do, you take the total amount of milk and you divide it by how many hours, and you say, oh, instead of giving her 60 per feed, I'll give her 40 every 2 hours or 30 every 2 hours, as long as she finishes that amount in that way. If you see that, let's say by any chance that I do not see you, like we said, if she's only drinking 10 or 5, you still have to supplement everything for the chew. But if you see that she's meant to be drinking 60 and she drinks 50 by the bottle, no problem, she drank fine. If she drinks more than 80% of her total feeds for that time, you can then keep the rest, let her rest, and then you give it to her later when she wakes up. I didn't put it in the notes. I'm just letting you know. Most likely I will see you before all of that happens. But if by some reason, if she drinks like 50 mils and there's a little bit left, there's no need to supplement it through the chew. Then you just, and if she does that for 2 days straight without you needing to supplement, then usually it's an indication that she doesn't need the chew anymore. But I always say, don't force it. Let her go at her own pace. If one day you see she's more sleepy than other days, don't try and wake her up to feed. She's basically recovering. She's been in hospital, so we just need to let her go. When she's awake and she's motivated, do it. But if you see today she was more sleepy, then just give her through the tube. You'll try it again tomorrow. It's like exercising, basically. Okay, we don't exercise every day.
At the moment, she stopped practicing the model feeding. Once she will get home, we can right away try her with the.
Yes, so like I said, I would say take a day or two, just let her rest. It's fine because she's still sucking on the pacifier, which is still stimulation. And then after 2 days, you can start again. You're going to leave with all these bottles, and all of them are written. So on the teat, they're written, and I tell you in the paper what to do with each, which one to start with. So it will say ultra preemie or Y cut or what. So I tell you.
I was confused.
Yes, so I tell you, start with the ultra preemie because it's the slowest flow. Use the Y cut if she's on thickened. If the milk is too thick, then you can use a Y cut because Y cut is cut in a Y shape. So when it opens wide basically. So that's why we don't want to give her with that one, just if it's just the milk. But if the milk is a bit thick, then you can give her with the Y cut. If you find that the Y cut it's still creating a lot of spillage, then you can take another teat, which is the preemie. I gave you all 3, and you can make just a bigger hole on it and then give her the thickened milk through there. But I explain everything to you in the paper. I answer all of your questions there. Okay. But you guys are you here tomorrow again?
Yeah.
Okay. So please read our home program. All of the information you need is in here. Have a read, and then tomorrow we'll come answer more. Friday, Saturday. Not us also. No.
I'm not sure on Saturday because as per the doctor, she might be discharged tomorrow.
Okay.
So we're not working.
Okay, but our number is in there. So if on Saturday or on Sunday latest, if you feel you need to ask us something, just call our department. Then we'll chat to you on the phone until we hear when you're coming in.
Sorry though, if anything like we are worried about, we have to disturb you to ask because like she's not the same like the other kid I have. She's like not normal for me.
Yeah, it's not a
So
typical
if
child.
in case there is any changes or difficult time for us, we have to.
Yeah, so if it's a medical situation, like let's say she starts desaturating a lot or her saturation levels are low or she starts changing color, or anything like that happens, then you have to call an emergency. Then rehab can't really help you. But if it's like a question like because of her splints, maybe her splint is not sitting right, or you see that there's a red mark that you're not used to, or she's sometimes she's drinking okay, and sometimes she's coughing, or sometimes she's not desaturating, sometimes she's desaturating, then you call us. Then we can help you with. But if it's a medical emergency, they change you on BLS, right? Basic life support. They haven't
Not
trained
yet.
you yet. Okay.
Not yet.
So they'll train you on your BLS to know what to do. But if there's any medical, if she's coughing frequently, vomiting a lot, changing color, saturation levels going down and they can't come back up, then you have to go to your nearest clinic. Or here, you said you live in Ourlittlewarrior, right? So you have to come here immediately to the emergency because then it's a medical situation.
If during the aspiration, if I notice that the milk is still there, it didn't digest, should I continue to give her for the next week, or I should wait for?
I think that you'll need to ask the nurse because they're the ones that train you on the tube feeding, so they will let you know how to do it. Because some I've seen they will aspirate milk, and then depending on the amount and the acidity, then they'll put it back in. So they'll put it back into the syringe, or they'll throw it out. So I don't know how. So they will advise.
Yeah, because I noticed that when we aspirate, still the milk is there's
still some milk coming out. Yeah, so they will advise you that. In cases like this, I always say, if you see you're still aspirating a lot of milk, try feed her less, more frequently. So if she's drinking 60 ml in 3 hours, try and make it 40 ml. Like I said, as long as she's getting all her feed, try and make it 40 ml every 2 hours and see if the less amount helps clear away, because sometimes their stomachs are so small and you pump all this food and it's stretching and it's going up and down in the chest and burning her. That's why also she got so much saliva because of all the acid as well. So all the saliva is building up. So see, experiment, and like we said, as long as she's getting all her feeds that she's supposed to get in the day, that's what matters.
That means if she's spitting a lot of saliva, that means it matters to her stomach.
Exactly. So it means there's a lot of acid. And I would say also watch her saliva. Now it's much better than it was. But if you see the excess, you wouldn't want to feed her with all that saliva. You wouldn't want to try bottle feeding with saliva because it means you're building already saliva sitting in there. Now you're putting in milk and she won't be able to handle it. And she won't start. So always just look at her saliva as well. If you find she's wet, she's got so much saliva, why would you want to feed her? Because it means there's still a lot of things happening in the throat. So rather wait for the saliva to get better and then try. I mean, now it's been better. I haven't been worried about it anymore. So yeah, small things like that.
Thank you very much.
Anytime. But our number's there. I mean, if anything, if you're still here on Saturday, our colleagues will be here to answer more of your questions. Yeah, but if you really want to talk to us specifically, we'll be here on Sunday.
Right, sorry. Then, may I ask this if what insurance category do you accept here?
That we'll need to find out from our reception desk. We don't know.
So if you do want to, you can go to our reception area. It's on the first floor rehab department.
Not first floor.
And you can go and ask and see.
That side?
Yes, just on the side.
Opposite
side.
So exactly on the opposite side. Unless the insurance department.
Another thing is when they leave and they put in the referrals for you to attend sessions outside
Therapy.
For outpatient therapy, what we do is we ask them for what insurance you use and if you can get approved. So that, I mean, if you want a quicker process, you can always just go down
Just go and ask.
to rehab or customer service. Then they will. But the documents are going to do it. So you will have to you can only do that when you get discharged, because that's when the order will be on the system.
Because they might accept the insurance, but the discipline they might not. Because some insurances, for example, don't pay for occupational therapy. But ultimately that makes the insurance. Understand? So it's not necessary.
Okay, when you pay for it when they're inside the hospital, but when they're outside, they don't. Which we don't understand. We also don't understand.
The prices we did put there is for if it's self-pay. So we have a little lower fee if you pay for yourself than compared to insurance.
Yeah, the prices were
Yes, so we put all the prices for you time-based.
okay.
I'll just show you one as well. Just quick. So these are all the stimulations that we've been doing today. And so like this, you see, when you come for an outpatient session, you'll have to come for a reassessment. So they will reassess her just to check, is she still the same, worse, better? So if you do one discipline each, meaning one session for speech, one session for occupational therapy, one session for physiotherapy, it will be 490 for each person. That means, let's say you come for 3 different sessions, that will be 490 times 3. But if you come for all of us at once, it will be 1,000, which is basically this times 3. It's actually the same amount. But after assessment, you just do one assessment from each profession. Then after that is therapy, and therapy is usually much cheaper. So you can do, so we've got an option where you can see all of us at the same time for a 45-minute session, but each of us sort of see you for a quick 15-minute session just to follow up, give you new strategies, and that will be it will be 15 minutes each, meaning 45 minutes for 3 people and 147 each. So it will be 147 times 3, which is like about 400. So that's 441. So that's, if we see you all in one session, it's 441. But if we see you individually for like 15 minutes just to follow up, it's 147 per session. But if we see you for longer, let's say we see that, okay, she does need a longer session, 45 minutes each will be 440 each, but all 3 of us at one time for 45 minutes will be 1,320. So sometimes you can decide. You can come and say, okay, you know what, today I'm going to come for an assessment for all 3 of them. Let me hear what they have to say. And then you're like, okay guys, you know what, it's too much. I can't see you all at the same time. Who should I prioritize on for now? You know, then we can say, okay, you can prioritize on feeding therapy for one session, but then when you come for your session, we ask our colleagues to pop in before we end our session to just check out. So, and then next week we do occupational therapy, but still speech therapy comes just to check up. But we'll have to talk to the outpatient team about that. But usually we can ask them to just pop in to make sure that everything is still okay. So we'll find a system sort of that works for you guys financially as well, just so that it's not all this money, but you need the sessions. We'll see what is actually needed at that time and what can be just followed up, and we just give you activities to do at home. And you will also see, like, when you're at home, what is she actually doing? Is she doing well with her exercises that you feel you don't need so much to follow up with occupational therapy every week, but feeding is still a big problem, or vice versa. She's eating better, but still that elbow is not moving. Then that's how you prioritize what she needs.
Like after she will be discharged, we should see you like after a week or 2 weeks for the month.
So we usually encourage, I say her next follow-up. So your next follow-up with the doctor, if you've got an approval, let's say if we're lucky and we get approval through the
insurance, we try and book an appointment on the same day. So you come from the doctor and then you come free. You do everything in one day. But if not, then we always say you then decide when you want to come because it's your money. You'd self-pay, so you then call us and let us know, okay, I'm ready to come. I want to come for this and this and this and this.
Because when she was admitted here, we were using common insurance, but that one it's drained already. And we got another insurance which is Aetna.
Aetna. I don't know. Yeah, I'm not aware of it. But
So yeah, as long as the doctor puts a referral, so on the day of discharge, you can just remind them to put a referral for occupational therapy, speech therapy, physiotherapy, and then that gets sent from our side to the insurance, from your insurance, and then
we try and get them
our
to.
receptionist will call you also, inform you whether it's rejected or approved, and then how many sessions is approved if it was approved. So they will always inform you as long as there's a referral from the doctors.
We should have that one before we will go.
Yeah,
On the day of discharge,
on the day of discharge, usually
they put in the referral in the system.
Yeah. So you can always just make sure that
They put it in, yeah. You can just remind them.
Yeah,
just say,
like
yes,
for
doctor, I have to
yeah.
attend rehab, physio, speech, and we wrote it all down in here. Yeah. So sometimes insurance accepts like an assessment only. So they'll say, okay, you can go for one assessment, but therapy you'll have to pay for yourself. Some of them will say one assessment and 5 or 4 therapy sessions. So
It will
we
depend.
always ask them. Sometimes they approve, sometimes they don't, and then we say, okay, if they don't, will you be able to pay for yourself? Some insurances even say you can pay, but then you can claim through them. So then you can pay with your money, and then you send a form to them.
Okay.
All right. But we've got our number here. The nurses have our number. If there's something that you remember before we go, or before you go, you can call us.
Sure.
All right.
Thank you.
Thank you very much.
Thank you.
Have a good day.
Thank you.